Hi, I'm Dr. Moshe Roth. I'm a developmental optometrist, board certified in vision development and vision therapy. Thank you for your interest in vision therapy. Most people have heard of physical therapy or occupational therapy or speech therapy, but many people have never heard of vision therapy, even though it's been around for over 90 years. Vision therapy is a series of exercises and activities designed to improve the function of the visual system. It's all about efficiency, how automatic things are with the least amount of effort. A coach once said, if you have to think about it, you've already lost. Think about hitting a baseball or driving your car. You have to make split-second decisions. If the decision is not automatic and you have to think about it, then you're liable to miss the ball or even get into an accident. Consider reading. If you have to think about every little thing you have to do while you're reading, looking at a word, tracking across the page, physically focusing, and putting the two pictures from each eye together, then it would be difficult to concentrate on comprehension or understanding what you've just read or remembering what you've just read. If you have to work hard to get your two eyes to work together to see just one picture, then you have less ability to remember what you've just read. If you have to think about your eyes tracking across the lines so you don't skip over words or skip lines, then you're not thinking about, what does this passage mean? What have I just read? If you have to concentrate on keeping the letters clear and in focus so you can see it clearly, it makes it more difficult to remember what you've just read. You'll get tired out and won't have the stamina to keep it up. And that's why some children or adults just quit. These are just some of the skills we have to have in order to read and understand what we've just read. Reading is so much more than just the individual parts and mouthing out the words. The purpose of reading is to understand what you've just read. Some kids might just lose interest in reading or think they're not as smart as the others in their class. It might begin to affect their self-esteem. Sometimes children might not even want to try and just say, I just can't, even before they start. Some kids might just lose interest in reading or think they're not as smart as the others in their class. It might begin to affect their self-esteem, and sometimes children might not even want to try and say, I just can't, even before they start. In vision therapy, we start out with activities that are relatively easy to do and gradually change them so that they become more complex as time goes on. The goal is to increase the difficulty until the point the skills are efficient and automatic, so the individual can spend most of their effort in the comprehension and the higher levels of reading. It gets easier and easier as time goes on. Typically, it takes 6 to 8 weeks for patients to begin to notice changes outside the therapy room. By that time, the patient has more stamina for homework and reading. Adults will start to notice fewer headaches when working on the computer, for example. A full treatment program may take several months. We expect each patient or parent to start to notice the changes within about 8 weeks. For more information, contact us at 732-679-2020 or njbeyond2020.com.